Sorry about my voice, guys. I'm kind of sick today, so I sound like a man. But anyway, so the respiratory control, the ventral respiratory group, or the VRG, and dorsal respiratory group, DRG, are in the medulla oblongata, and they make up the medullary respiratory center. The VRG controls rhythm of inspiration and expiration. And for inspiration, inspiratory VRG neurons, they fire and send action potentials to the diaphragm and external intercostals, and this makes them contract. And then for expiratory reactions, the expiratory neurons of the VRG inhibit the same neurons as the inhibitory neurons, or as the inspiratory neurons, causing the muscles to relax. And this causes the lung to recoil or decrease and expire. And then there's the pre-Botzinger complex, and this is just a cluster of interneurons. And these three things make up the resting breathing rate of about 12 to 15 breaths per minute. But if there's alcohol involved, this can suppress the VRG neurons, which can stop breathing completely. And so the drug BIMU8, it's right there, BIMU or BIMU8, it will stimulate the VRG neurons to increase respiratory rate to get it back up if someone's had a lot of alcohol. So that's the VRG. And then the DRG, this receives information from the peripheral chemoreceptors and the Macono receptors. And it goes to the VRG, and it modifies their actions toward ventilation. And then there's the pontine respiratory group, PRG, and this is just like the DRG because it receives information and acts to modify activities in the VRG also, but it's more specific to helping adjust breathing rate patterns for activities, just like sleeping and exercising. So that's the difference between the DRG and the PRG. Okay, and then breathing. So the cerebral motor cortex, it can override the medullary control of respiration. So an example of that is just like holding our breath. We can control that. And if we hold our breath for more than 2 minutes, carbon dioxide gets built up and causes our diaphragm and intercostals to start to spasm. And if levels of carbon dioxide get too high, then the medullary respiratory center overrides the brain, forcing us to gasp for air. And some swimmers practice oxygen loading, and this is when they make themselves hyperventilate before their swim race so that they can hold their breath longer. And this increases blood oxygen levels, but it decreases carbon dioxide levels. And so this is dangerous because since it decreases carbon dioxide levels, and carbon dioxide is the main thing telling you to take a breath, by the time those levels get back up to where they're supposed to be, to tell you to take a breath, the swimmer could have already passed out underneath the water because they don't have that signal. And then world record holders for holding their breath submerge themselves into cold water, and this reduces oxygen consumed by tissues and reduces carbon dioxide levels also. And they also do lung packing right there. And this is when they inhale all they can and then some more. And they do that by swallowing air. It's just like a technique that they learn. And the world record for holding your breath for pure air is 22 minutes. And the world record for without pure air, just oxygen, is 11 minutes. And then chemicals that regulate ventilation are carbon dioxide, oxygen, and then there's pH regulators also. And carbon dioxide is the most influential and controlled chemical regulator of ventilation. It crosses the blood-brain barrier, and hydrogen levels raised by the same reaction catalyzed by carbonic anhydrase? I don't know how to say that. But the elevated hydrogen concentrations are detected by chemoreceptors in the medulla oblongata, and high levels of carbon dioxide in the blood are called hypercapnia, and this, along with hydrogen ions in the brain, makes an increased rate and depth of ventilation. And low levels of carbon dioxide, which is called hypocapnia, will have the opposite effect. So it'll decrease ventilation. And then we have the oxygen. And oxygen has, both oxygen and carbon dioxide have chemoreceptors in carotid arteries and aortic arteries. So I forgot to mention that up there, sorry. But oxygen also has those chemoreceptors. And oxygen partial pressure in normal conditions is 95. Hypoxemia is low level of oxygen in the blood. And not until levels drop to around 60 mmHg, once it drops down to 60, that's when oxygen starts to stimulate an increased breathing rate. And then the pH regulator, so there's 3 components to the negative feedback loop. There's the receptor, the control center, and the effector. And we already kind of know about these things, but the receptor in this example is the peripheral and central chemoreceptors. And those are the carotid and aortic and the medulla oblongata. So those receptors are the receptors, obviously. And then the control center is the medulla oblongata, and the effector is the lungs. So that's not too hard to remember. And then we have diseases. COPD, that stands for chronic obstructive pulmonary disease. Smoking causes about 80% of these cases. And then there's emphysema, I'm not really sure. But smoking, chemicals, or hereditary factors, in this case, damage the walls of the alveoli, and it makes them less elastic and enlarges them. And this just means that, like, when a person who has this has to force themselves to exhale, and this takes a lot of energy. And then there's dyspnea, and this is labored breathing, so you have to really try to breathe, and this leads to a barrel chest. And so when you become exhausted from forcing yourself to exhale, and the damage to the alveoli leads to damage of pulmonary capillaries, this damage causes increased resistance to blood flow through the pulmonary capillaries, putting extra work on the right ventricle, which eventually leads to right-sided heart failure, or it could lead to right-sided heart failure. And then chronic bronchitis is when a long time exposure of like irritants like cigarette smoke to air passageways. And the cilia that line the lower respiratory airways become damaged from smoke and pollution and all that stuff, and they lessen out. They get fewer and fewer, and they can't clear the smoke and dust away anymore, and it gets trapped. And this leads to it building up and blocking the airway and ventilation, and this is why people with chronic bronchitis are always coughing and wheezing, because they are trying to get that out. And then there's asthma. There's a little bit right there. And asthma is the inflammation of airways, and the symptoms are chest tightening, coughing, and wheezing. And research shows that it might be due to genetics. A lot of it has to do with genetics. And also the larger gap in the ratio of the Th2 and Th1 lymphocytes in cord blood may be a predictor of later developing asthma as well. So the bigger the gap in ratio, the more likely someone's going to get the asthma. And then there's also environmental factors, and one of them is being too clean. Because when someone's too clean, they're not being exposed to bacteria and pollutions and all that good stuff, which lessens their Th1 lymphocyte and increases their Th2 lymphocytes. And that just like earlier, it makes a larger gap between the two ratios, which makes it more likely that that person will have asthma.